It's particularly important to stress test the cervical spine, particularly the craniovertebral ligaments. Now, when we do these tests in the craniovertebral region, we're not simply looking for instability, although that, of course, is important, but we're also looking for the reproduction of central nervous system signs, or anything that's possibly ascribable to the central nervous system. Then we'll investigate that further. Now, consequently, the first test, the transverse ligament stress test, is as much an ischemic test as it is an instability test. So in this case, and really just for this case, the stress test is held for about 30 seconds. In most other stress tests, you hold it until you get a good end feel or until you reproduce symptoms. But in this case, it's at least 30 seconds or until symptoms are reproduced. We'll be doing the Aylor Ligament kinetic test, not the stress test, and the stress test is actually covered on volume 2. We'll also be looking at the transverse stability test for the atlantoaxial joint, and then posterior-anterior pressures for the cervical segments, and finally the vertical stress test, traction and compression. So, looking at the transverse ligament first. I'll cup my hands underneath the patient's occiput, so I've got them nicely supported in the occiput, and my index fingers will go underneath the neural arch of the atlas. Thumbs will come across the front of the face, like so, and then I'll simply shear the head and C1 forwards on the neck. And I'm looking for a normal end feel and the reproduction of symptoms. Now, as I do this, I want the patient's eyes open so I can see nystagmus if it occurs. And to look for speech defects, I'll ask the patient to time this for me by counting from 30 backwards.
30, 29, 28, 27.
Great. So we've got a built-in automatic timer there, and we can see whether or not the speech becomes disturbed as we do this test. Okay, for the Aylor ligament, I'll palpate the spinous process of C2, like so, and then I'll side bend the head around an axis running through the nose, which will be the craniovertebral ligament, or the craniovertebral axis. And as I side bend this, I'm feeling for the spine of the axis to immediately move to the opposite side to the way I'm side bending. And this is because if I side bend to the left, then the right Aylor ligament tightens and it pulls the C2 into left rotation, which shifts the spinous process to the right. And it's the immediacy of the movement I'm interested in, not the amount of movement. And if the movement's delayed, it may well be due to the fact that the ligament is insufficient. The stress test for it, as I say, we'll cover on volume 2, but essentially that would confirm this test. The transverse shear test for the AA joint, I'll use the soft pad of my index finger, MCP, on the tip of the transverse process of C1 and on the other side C2, and I'll shear them across each other transversely. And now I'm looking mainly for end feel, and this should be solid, there should be no give to this, but it may also reproduce cardinal or non-cardinal signs and symptoms. Okay, for PA testing, can we turn you over, Beverly? Don't use the spinous processes to push on. There's usually not enough spinous processes in the neck to go round. A lot of these are very small, so where you would expect to see 7 processes, you may actually only count 4 or 5. Rather, come on to the transverse processes. So C2 is an easy one, and we'll push that forward on C3, then just move yourself down as you go, and push on each transverse process in turn to produce that posterior-anterior pressure, which, like everywhere else in the spine, because we're not actually stabilizing anything else, is both an anterior and a posterior stability test, as well as being a mobility test with extension at each segment. Sit up for me, face that way. And then finally, we can look at traction and compression. Traction, very gently, just put your hands on top of the head and let the weight of your arms fall through their head, and then gradually increase the pressure until you get an end feel or until you reproduce symptoms. For distraction, we'll put our hands underneath the mastoid processes, elbows on the shoulder, just lean them back a little bit, and then just squeeze your hands together like so to produce the distraction. Now, it's often advocated that these tests are done in flexion, extension, neutral. There's some recent evidence coming out that the reason this was done this way is no longer valid. For example, extension was thought to affect the craniovertebral region, flexion the lower cervical, cervicothoracic, and neutral the middle cervical spine. The most recent study that's come out using x-rays and measuring the x-rays with different degrees of traction says that this just isn't so. And in fact, from flexion to extension, rather than the level that you're affecting, it's really whether it's the zygapophyseal joint or the interbody joint that's being affected. So if you want to do it in flexion, extension, and neutral rather than just in straight neutral position, just bear that in mind. Okay. Having done the stress test, we've actually completed the routine examination of the cervical spine, and all that will leave us with some special tests. And we'll look at those, and the tests that we'll be doing will be quadrant testing, upper limb tension testing, and vertebral artery dizziness testing.